Hello and welcome to AV Global, guys. We are at the David Tvildiani University and we have the faculty of the David Tvildiani University who will guide us through entire MD program at the university, how the things works and how they coordinate with Indian student and why David Tvildiani holds such a high number of passing ratio for Indian students in FMG as well as for the USMLE. So we will get to know from the experts here. So ma'am.
So hello for everyone. I'm Dean of Faculty, Medical Faculty in David Tvildiani Medical University, Professor of Internal Medicine, and for years ago we get Indian students here and some information regarding our programs. You mentioned correctly that our graduates are on the first place for passing Indian and other countries' qualification examinations, and how we provide our studies here. I think that it will be very important. So these MD programs in Georgia and in these universities, 360 credits and 6 years studies needed to finish it. 5 semesters are so-called basic and clinical science stage. Then these follow clinical stage studies, and all these clinical subjects, they are for all these clinical subjects we provide on our clinical basis. And then is the finishing year, 6th year, it is internship year, and after that they have summative examinations. But how we start? You see, for future doctors, we need solid knowledge of medical sciences knowledge, and also practical skills which can be elaborated, acquired during these 6 years. First of all, I wish to mention that all our programs, we have only medical programs and also PhD in medicine, biomedicine and health sciences, are focused on this field of education, only this. And for this we have also our subject of research also is medical education. We are focusing especially on this. This is regulated programs as in every other country, so it needs accreditation, authorization first of all of the university, and accreditation each of these such programs. And we have any required authorization and accreditation for this, and beyond European accreditation, so-called we are a group of piloting European ASINAMSE accreditation. So how we educate students? First of all, I need that mention that one big thing is knowledge, and we are prepared these students with such materials. I mean, first of all, textbooks and so on, which are, I don't know, on the first choice for every university in the world. Second, knowledge is not enough. We give them very solid, believe me, knowledge, but this needs somehow to be applied. This knowledge can and must be reasoning. So one of the most important skill of future doctors is our reasoning skill. So for this reasoning, we have special formats in our undergraduate program, starting for the first year of education. And these formats are relevant to such providing and assessment of such reasoning skills. This is problem-based learning classes, this is practicals classes, this is simulations which we provide during the first 5 semesters for preparing them for clinical subjects. Yes. Simulation patients we will use for observing and also assessment of their reasoning skills. After these 5 semesters, they have, during this semester, they have 3 very important summative examinations. They have everyday examinations for sure. They have oral examinations, but the material is organized amongst the modules. These modules are human organ systems-based modules. So if you take, for example, cardiovascular module, it means that starting from anatomy and embryology, including diagnostics of diseases of this system, and pharmacology, general principles of pharmacotherapy are included in these modules. And then they have so-called quizzes for examining in this material. The student cannot pass these semesters. They need to take pass for this during this semester 3 such big modules. And after their 5 semesters of study, they call it summative. We provide them summative examinations in all basic and medical sciences, and they need to pass them to go to the clinical stage of education. It is different, for sure, for other universities, I mean other Georgian universities practice. Also, they have such type of examinations in clinical subjects after their 5 years of studies. That's why I think they are so prepared also for these examinations, yes, which you already mentioned. Then, during the clinical stage, you can see our clinical basis. They are well prepared for communicating with patient, because we think that it is not enough to observe practice, but practice of other physicians in the place of the education. Yes. In departments of cardiology, for example, or obstetrics and gynecology, or somewhere. They need some to take and start communication with patients like physicians. That's why we are prepared them in this during these previous 5 semesters in simulation area, in simulation classes. We use also virtual patients cases, very many virtual patient cases for this. And they step by step use this skill of decision making in safe environment. It is very important for preparing for clinical stages. As I mentioned, not only to observe, but doing something like the patients. Yes. It is also different in this university. Then they have, as I mentioned, clinical rotations. They are there. This university space is not only this campus or training center or classes and auditories, but also, as I mentioned, 3.5 years they are spent in our clinical basis. After with our supervision, for sure, but on places they have their professors which educate them, also for sure discuss the cases and make good decisions, I think. So this is about our graduates. Also, we support their fellowships and short-term practice in other countries. We are looking for their career development. For example, I know as a dean that, and my assistant also is in charge, to understand in what field of medicine the student wants to practice in future. For this, we have also on the 6-year studies, a full 1.5 months to give them possibility to gain much more practice in that field. For example, in neurology. For example, yes. And we organize this not only in this country, because we understand that most of them are returning for there, or for example, applying to US Emily or United Kingdom for sure. That's why we are looking for this and organize them these short-term practices in that countries in which they see themselves for future practices. It is very important for them. So we also try to support them doing some scientific activities and scientific works. What I clearly want to state, yes, we have Georgian students and foreign students. Everything we are doing for Georgian students, we are doing for
Indian students.
Absolutely identical. For example, supporting them, I don't know, we have some system, we reduce the price of their education if they take some, I don't know, 91 and more, or 81 or more
as per their achievements in academics, they get a scholarship from the university.
They gain absolutely the same possibility. Also, for example, they are working together in so-called CISA. CISA is Students and Young Scientists Scientific Organization in this university. And they done, for example, fantastic work 10 days ago when we have very big conference. We're hosting European conference for PhD studies. And our students task force, half of them were Georgian and half of them Indian students. So they are working together, and it is also very important for their future. I think equally important for Georgians also. So they are organized so-called interest groups. You see, in this university, I don't, for the starting of his functioning, his practice, senior students are helping the younger students, yes. Nice. And this now organized 5 or 6 years ago in interest groups. For example, students find that each other who are interested in surgical sciences, for example, or and they organize so-called SIGA. Then they organize so-called GIGA, which are interested in obstetrics and gynecology. Then neurology group is also very strong in our university. It is their groups, these students' groups, and they are teachers there. Okay. For educated, of course, supervising and preparing, yes. So we try not for their communication, peer-to-peer communication, and also on safe environment acquire very important for future doctors skill decision making, because in any case. Doctor is decision maker, first of all, and to take on this responsibility is very important for them. Yes, so I think that they have interesting life. You see, as usual, medical programs are so much regulated. Everything is core for the education, you see. But I think that they find such formats for peer-to-peer assistance, for being together, to do the same tasks together. And it is also very important for their future lives, I mean, first of all, professional life also.
So basically what we have seen here, that David Tvildiani University holds a 360 credit which is regulated by the Georgian Education Ministry, 60 credits each year. You have two campuses,
Yes.
one in the Rustaveli and one in the Tbilisi. Students are arriving for the first 5 semester in a Rustaveli campus for their preclinical subject where
Yes.
they are learning on the problem-based learning is
Yes.
there, and then you have multiple libraries and your laboratories, and faculties are within the same building. Students are staying in the same building in a safe environment.
Yes.
In a new country. The university helps them to adopt with the local culture, environment and the weather. And then after the 5 semester, when your preclinical subjects are over, they moved here in the Tbilisi campus where they start their clinical rotation, like clinical subjects, and another 5 semesters they stay here, and then 2 semesters they go to your hospitals.
Yes,
for their
not 2
practical.
semesters, but it counts from the 6th semester, including 12th semester.
Okay, from 6th
Yes.
semester till 12th
And
semester.
I also want to mention that for our law it is important to provide them Georgian language.
Mhm.
And 12 credits are mandatory. We provide these 12 credits in a very interesting manner, and for what is interesting, that they are not included in this
360 credits, then additional
Yes,
12
for sure.
credits.
It is additional,
Wow.
yes, from our side.
Okay, that's
Not paid from, needed to pay from
your own
their
side
side.
pockets. Okay.
Yes.
So that is very good. So student gets on a day-to-day basis all the knowledge required for the Georgian language.
Yes, for
additional
communication with
for the communication.
with the patients. It is
Patients.
important. Yes.
Yeah. And the university is organizing a multiple new way of learning, from peer-to-peer communication as well as like advanced life support basis studies, which helps Indian students to achieve their goal and becoming a successful doctor, as well as the university is helping them to study USMLE, or they're preparing them for the further education by providing them a very high level of a practical knowledge in an advanced atmosphere or the technology which is available with the university.
Yes.
So as the dean of the university, she is going over and beyond within her limits and trying to educate each and every student to achieve the maximum knowledge in David Tvildiani University. So
Yes.
thank you so much for your valuable time, and we're really thankful for you having us here and providing an Indian students how to pursue their career here in Georgia at one of the most prestigious university, which is David Tvildiani.
Thank
Thank
you.
you. Yeah, thank you. Really appreciate it. No, yeah, thank